Hello, good afternoon, everyone. Happy Wednesday to you all out there. How are we all doing today? I trust you are doing great and I trust your day is going on well. Compliment of the season to you all out there. This is Dynamic Health and Wellness with Juliet. It's a place we talk about all aspects of our health. So you are welcome to this afternoon broadcast, and wherever you are joining from or just seeing this for the first time, this is where we talk about all aspects of women health. So don't forget to also follow us on our Facebook page, on our YouTube, and also subscribe to our channel where you can always get update by turning on your notification bell. So this afternoon, we are going to continue from our series of discussion this week. We are looking at prolactin hormone. And in the last broadcast, we look at the functions of prolactin in the body, because prolactin is very, very important. It's an hormone that supports a woman, especially lactation production, milk production in the body. Apart from that, it also has a lot of role to play, even in the men health, the sexual health as well, because it also works along with other hormones in the body. So this afternoon broadcast, we are going to be looking at what causes abnormality in the level of the prolactin, and what are those symptoms you need to watch out for if the level of the prolactin is higher than the normal level, because the prolactin hormone naturally remain low except a woman is pregnant or breastfeeding. This is what can lead to a slight elevation of the hormone in the body. But apart from that, there are still other things that can cause an increased prolactin production, because the prolactin normally rises when a woman is pregnant or when is just breastfeeding, when it's breastfeeding the baby. And there might also be a slight increase due to some other situation, like when a woman is stressed. When you are stressed or undergoing any stressful situation, this can trigger an increase in this hormone. Like exercising, excessive exercise can also distort with this hormone. Eating disorder, there are some meals that when you eat them, it can also affect it. Sexual intercourse, nipple stimulation that is not related to breastfeeding, and also injury in the chest area, epileptic, like a kind of seizures. So all these can increase prolactin level in a slight way, but this increase is going to be temporary. So there are certain conditions that will cause the elevation of this prolactin to stay for a longer time. Now it become a kind of persistent elevation of this prolactin hormone. So in this evening's broadcast, we are going to look at what causes abnormal. When you now say abnormal high level of this prolactin, it means that the level of the prolactin in your blood is higher than the normal level or lower than the normal level. So we are going to look at the two. When it's higher, it is known as hyperprolactemia. And when it's lower, it's known as hypoprolactemia. So we are going to look at each of them. Please just take 1 minute out there so that we can share this video to others so that they can join. You can help me share as well so that we can invite others to join us in this broadcast this afternoon. Let me just quickly do my sharing so that they can join me. So, like I said earlier, that the prolactin level can be elevated more than the normal level. And when someone prolactin in the blood is higher than the normal level, the person is experiencing abnormal level of this prolactin, which is also known as hyperprolactinemia. And certain factors and conditions can cause a higher than normal level of this prolactin in the blood. And prolactinemia include one of the most causes is prolactinoma. Prolactinoma is a pituitary gland tumor. This is one of the things that normally causes a kind of higher than normal level in the prolactin in the blood, because this prolactin is produced and secreted from the pituitary gland. It's a gland that is located at the base of your neck, just below the hypothalamus. So this is one of the reasons that can lead to a higher than normal level of the prolactin in your blood. Thank you for joining me. You are welcome. Compliment of the season. Please don't forget to like and share our video as you are joining. So, a prolactinomia is the most common causes of a higher than normal level of prolactin in the blood. So this condition is a kind of disease, not cancerous tumor that is formed in the pituitary gland. And when this happens, it can cause excess production of prolactin. It is a type of pituitary adenoma. This prolactinomia normally occurs most commonly, especially in people that are assigned female at birth and below the age 40. It is mostly common in women and normally rare in men. So, which means this prolactinomia can normally happen in women that are below age 40, and it is normally low. That is rarely occur in men, and also rarely occur in adolescents and kids or children. Another thing that can also cause a higher than normal level of prolactin in your blood. Thank you so much. Thank you for the love. Thank you for the comments. Thank you. God bless you. Another thing that can also cause it is certain medication. There are certain medications that you take that will distort your brain chemicals, especially the neurotransmitters that are regulating your mood, your action, your feelings as well. This brain chemical, especially dopamine, it helps to suppress the production of prolactin in the body. So any medication that one take that affect the production of this dopamine neurotransmitter in your body can make the prolactin in the blood to rise above the normal level. So that is why when one is taking some medication, there will be a kind of symptoms or reaction in the body. Thank you so much for the reactions. Thank you. God bless you. There will be a kind of symptoms or reaction on the body. And this can also distort with your hormones as well. So another thing is medication that normally distort with these neurotransmitters in your brain are medication that are used in a suppressing depression, like antidepressants. Such medication can distort with your brain chemistry and interfere with your body dopamine hormone. Also, other medications that are used to treat certain high blood pressure. High blood pressure medication can also interfere. And medications that are also used in treating nausea and vomiting, as well as pain relief. All this can also affect your brain chemical dopamine, which can lead to elevation of this prolactin in the blood. So if you have a high level of this prolactin hormone in your body due to medication, you will discover that when you stop the medication or you stop using this medication, the level of your prolactin will return back to normal after 4 days or so. So after you stop taking this medication. But one thing you should know that You should not stop taking any prescribed medication unless your healthcare provider have told you to stop. So note that any medication that is prescribed to you by your healthcare provider, you need to use it. But once you stop using it, definitely the level of your prolactin is going to subside and return to normal. Thank you so much. Thank you for those reactions. So another thing that can also lead to a higher than normal level of your prolactin is certain health conditions. There are certain health conditions that can affect your cause hyperprolactemia other than prolactinomia, because prolactinomia is one of the major causes when there is a kind of tumor or a disease on your pituitary gland. But aside that, certain health conditions like kidney disease can affect it, can cause it, and also hyperthyroidism, a kind of underreactive thyroid. Underreactive thyroid means your thyroid gland is not producing less of the thyroid hormone, and less of the thyroid hormone can interfere with your prolactin level. And also, when a person is also having a kind of rashes or brittles on their chest, you see some people do have rashes on their chest, and a kind of rashes, I don't know what to call it. So these things can also lead to higher level of the prolactin hormone. Hello, thank you for joining me. You are welcome. And another thing is other pituitary gland tumor. You know, because the pituitary gland is very, very important. It is a very important gland, though it is very small, but it performs a lot of role in the body. And so when it comes to prolactin as an hormone, any injury to the pituitary gland is definitely going to affect the level of prolactin in one's blood. So what normally causes all this high level is what I've just explained. So apart from that, there are things, there are ways or sometimes that the level of prolactin in your blood will fall down above the normal level. And that is what we call hypoprolactemia, or it also called hypopituitarism. So remember that the prolactin level are usually low unless a woman is pregnant or she's breastfeeding. This is one of the things that can elevate the prolactin in a woman's blood. Thank you so much. Thank you for those reactions. So if a woman is not breastfeeding and she's not pregnant and the level of prolactin in her blood become lower than normal, the only sign that will indicate that one is having a lower than normal level of prolactin is when there is no breast milk production. When there is no breast milk production after giving birth, this can happen to some women. After they have given birth, they discover they don't have breast milk to feed the baby. The breast is not running out. And in this case, hyperpituitarism is usually the cause. Because this hyperpituitarism is a rare condition, though it is rare, in which there is no lack, there is a lack or a deficiency in one of those hormones that your pituitary gland make. If it is not one of the hormones, it can be to one or two or three of this hormone that your pituitary gland makes. So a deficiency in this hormone that is made by the pituitary gland can cause this lower than normal level of your prolactin, and it usually causes a kind of abnormal pressure on your pituitary gland or a kind of damage to the pituitary gland. So when one has an abnormal level of this prolactin, whether it is higher than normal level or lower than the normal level, there are still going to be some symptoms. There are going to be some signs to indicate that your body, the prolactin level in your body is low or it is too high. So what are those symptoms of higher than normal level of prolactin? When a woman has higher than normal level of prolactin, what are those symptoms? For anyone, higher than normal level of prolactin in the blood can cause the following symptoms. One is infertility. In a woman, Infertility is one of the signs and symptoms that a woman has an abnormal level of prolactin in her hormone, because this hormone, prolactin, it plays a huge role in a woman's fertility. So when a kind of a mild or little elevation of prolactin, when you go for a prolactin test and it reads 25 to 50 ng milliliter, this is a mild elevation, and this can usually cause or notable or no notable symptoms. There will not be symptoms, or you might notice some symptoms or might not notice any symptom. Why? Because it's a mild case. It's a mild elevation of this prolactin in your blood, and these symptoms might include affect your menstrual cycle, though they may decrease or might not decrease your fertility overall. But when there is a higher prolactin level that indicates your blood that reads about 50 to 100 ng milliliter, this is a higher level of elevation of prolactin, and this may not cause notable symptoms in your menstrual cycle that will cause a woman to begin to experience irregular menstrual cycle, and this can significantly decrease the woman's fertility, because prolactin affects a woman's fertility by hindering ovulation. For this reason, a woman who is breastfeeding might not have periods. However, some women may even have higher level of this prolactin even when they are not even breastfeeding. And when this happens, this can begin to affect the woman's fertility, leading to infertility problems. So remember that under normal condition, a woman's body produces a very little of this prolactin unless she is pregnant. So higher level of this prolactin cannot stop the process of ovulation, or it can even slow it down. And when the ovary might not be releasing an egg regularly, or sometimes it might not even release egg at all, meaning the woman might be ovulating intermittently as well, or sometimes the ovulation might just cease. And this can be seen in the form of a woman experiencing absence of period, irregular period. In this case, if the egg is not released according to schedules, couples that are believing for a baby cannot be able to time their intercourse because ovulation is not steady. And this may not become a kind of natural way of affecting or making it difficult for conception to take place. So in some cases, the prolactin level may not be as high enough to prevent ovulation, but can also affect the production of progesterone, because this progesterone, estrogen, and your prolactin, they work to regulate a woman's menstrual cycle. Excuse me. So they want to regulate a woman's menstrual cycle. So this progesterone, it is an hormone that takes over the second phase of a woman's menstrual cycle. So after ovulation, your estrogen level decreases because it's estrogen that stimulates ovulation. So when the pituitary gland signals to the ovary to begin to release estrogen hormone, this estrogen hormone will begin to trigger the egg to be released. So when egg is released and a woman has ovulated, the level of the estrogen hormone decreases, and the pituitary gland will signal to the progesterone that it is now to take over. So progesterone will now dominate the second phase of your menstrual cycle, which will help for proper implantation of the baby if fertilization takes place, and provide a healthy environment for the baby to stay on through the pregnancy. So in this case, when a woman has a higher level of prolactin. This cannot prevent ovulation and may also affect the production of progesterone hormone, which is also responsible for thickening of the uterine wall and also providing a safe environment for the fetus to develop after ovulation. This is what we call the luteal phase. So, and when a luteal phase of a woman is shorter than the normal, this can also be due to the amount of progesterone that your body is releasing. So low amount of this progesterone can shorten the luteal phase and keep the uterine wall, instead of being thickened, it become thin. It become thin and no longer thickened. And remember that the thickness of the uterine wall help to support a healthy pregnancy. And this may result in thin uterine lining that does not allow for a fertilized egg or to be properly implanted in the uterus due to the thin uterine lining. And as when this may happen, even if the egg is fertilized, it will not have a chance to develop properly into a baby. And this is what normally leads to spontaneous abortion. Miscarriages. So, in a woman, due to high level of progesterone. So, this is how high level of progesterone one symptom, it can cause infertility. Another symptom is loss of sex drive in a woman, even in a man, because this hormone, it regulates your menstrual cycle. And in a woman, when you have low level of estrogen, which is your female sex hormone, which regulates your sex hormone, which help to stimulate your sex drive, low level of estrogen will result to low sex drive as well. So another symptoms, you begin to experience a kind of milky discharge from your nipple when you are not pregnant or you are not breastfeeding. Many people experience this, and this is what we call galactorrhea. Because you are not breastfeeding, you are not pregnant. Why is your breast discharging milk when you are not pregnant? So this is to let you know that your body is producing higher than normal level of this prolactin. So you need to run for a test, and this can also be corrected if you detect it on time, you follow it up on time. So for people that are assigned female at birth, symptoms of this high level of prolactin involve changes in your menstrual cycle related to menopause. You'll be experiencing, woman will begin to experience, I'm still in the early 30s. Why is it that I'm having missed period, I'm not pregnant? It's like, because menopause is a kind of transition whereby a woman will no longer be seeing a period. But when you are beginning to experience those symptoms like irregular period, absence of period, amenorrhea, you are not pregnant but you are not seeing your period. These are symptoms related to menopause. It shows that you are having lower, higher than normal level of this prolactin hormone. Another symptom you also be experiencing is pain or discomfort during penetrative sex, which has to do with dryness, thinning of your vaginal wall. So due to this thinning of your vaginal wall, you'll be having pain, cannot bear the pain, a discomfort during intercourse due to dryness of the vagina. And for the men, they also have some symptoms of this abnormality in the progesterone. For men, when their prolactin level is not in the balanced stage, they will begin to experience symptoms like erectile dysfunction, low level of testosterone, and enlargement breast tissues, which is known as gynecomastia. So these are symptoms that are related to the men if they have an imbalance in their prolactin level, because hypogonadism is almost always a cases of endostropathy that normally affect erectile dysfunction in men. So in the hypoprolactemia, this will include hypogonadism, a kind of excess prolactin can interfere with the secretion of the gonadotrophin releasing hormone. And this hormone is what normally regulates the sex drive of a man and as well in a woman. So this decrease may result to decrease in their testosterone and erectile dysfunction. Remember, in a man, when a high blood prolactin concentration is high in their body, this will interfere with the function of their testicles, and it will also affect the production of testosterone. And this testosterone is their main sex hormone. And this testosterone is responsible for their sex drive, sperm production, muscle mass, energy level, as well as blood count. So this sperm production may therefore decrease due to high level of this prolactin. It can also lead to low testosterone, causes decrease in their energy level, as well as their sex drive, their muscle mass, and at the same time, it will also affect their red blood cell count, which can also make them to be deficiency in iron, and this can probe them to anemia. So if one is experiencing any of these above symptoms of excess prolactin level, which is hypoprolactemia, such as in a woman, irregular period or loss of interest in sex in both sex, no absence of period and ovulation. There are so many symptoms. All the symptoms I've explained. If you are experiencing any one of them, please try to consult your healthcare provider. They can order you a simple blood test. A simple blood test is what can check your prolactin level. You cannot be able to detect your prolactin level without a blood test. So a blood test is what you can use to determine your prolactin level. So remember that prolactin is an important hormone for pregnancy and also for breastfeeding. That is chest feeding. So while having higher than normal level of this prolactin, it can affect the woman's fertility. If a woman is not pregnant and she's not breastfeeding and she's having a higher normal level of this prolactin, though it is not a life-threatening situation, but it can cause so many unbearable issues and symptoms. Issues like infertility, which can also at the same time can also affect your quality of life. So be sure to consult with your healthcare provider if you are experiencing any of those signs of hypoprolactemia. They can be there to help you, and there are medications that are available for you to use that can reverse this condition. So people might begin to wonder, can high prolactin level be brought down or reduced or lower? Definitely the answer is yes. But it depends on what is causing the elevated level of this hormone. So from there, you can be able to get the right prescription medication that can help you to lower it. So remember that early detection is better, it is safer, and costless than cure. So the more you detect, the earlier you detect it, and you follow up, you see that you will get immediate result. If you are a TTC and you are experiencing symptoms or struggling with infertility or you are experiencing irregular menstrual cycle, absence of ovulation, please get your prolactin hormone checked. Prolactin hormone is the only hormone that can also help to know what actually or what hormone is not working well, because a higher in this prolactin can affect your estrogen, your progesterone as a woman, and in a man it can also affect their testosterone as well. So in that case, get your prolactin level checked and try to balance this hormone. In my next broadcast, we are going to look at how to lower this prolactin hormone naturally. There are also natural ways and other supplements that can also help you to lower this prolactin hormone and live a good quality of life, and as well as achieving your fertility goal. So thank you everyone for joining me. Thank you so much, Jenny. Thank you, TR John. Thank you everyone. Thank you for your like, your comment, your reaction. And do not forget to share this video. Share and also follow us on our page, Let Me Get Awareness. And also do me well to subscribe to my YouTube channel, where you can be getting more updates. So please, I wish you all the best of the day and see you again. Compliment of the season to you all. Bye.